Asian Doctors, the show where we engage in meaningful conversations on the health topics that matter most to our communities. I'm your host, Dr. Linda Thomas, and today's episode is a crucial one: Breaking the Silence: Mental Health in South Asian Communities. Despite growing awareness, mental health remains a sensitive and often neglected topic in many South Asian households. To guide us through this conversation, we are honored to welcome Dr. Masroor Mubeen Phulpoto, an NHS health professional, educator, and executive member of the British Pakistani Psychiatrists Association. Welcome, Dr. Phulpoto, and welcome to Health Matters.
Thank you.
Could you start off by sharing a little bit about the journey in medicine and what inspired you to focus on mental health?
So my journey in medicine started back home in Pakistan. So I started, did my bachelor's there. Post that, I've worked in multiple biggest hospitals in Pakistan, including the biggest hospital in Karachi, the biggest hospital in Islamabad. So moving up, and then I decided to come over to UK for professional training. Then I've been in UK since last 5 years, working initially in down south in England in intensive care, emergency medicine, and then moving on to mental health. Specifically in Glasgow, I've been working here since past 3 years in multiple branches of mental health. I've been working in forensic psychiatry, old age psychiatry, general adult psychiatry, CAMS, and now I'm based as a general adult mental health professional covering the south of Glasgow.
No, brilliant. Thank you so much for that very concise introduction to your journey in medicine and what inspired you in the different sectors you work here as well. So you worked in NHS DTC for about 5 years. And how have your experiences in the UK shaped your approaches to mental health care?
I think UK's mental, because I've worked in two very different kind of healthcare systems. There is differences of day and night in those. In Pakistan, the mental health is more of a neglected field. It's growing now because of the awareness spreading.
Yeah.
In UK, it is more established, and UK has a lot of funding available for that field, a lot of setups, different guidelines, psychiatrists. So UK is more of a leader in the field, while the South Asian countries are still catching up. So you could see the difference, the difference in infrastructure, the difference in funding, the difference in staffing, the difference even in general community level prioritizing of the mental health. Because mental health is more of a stigma topic still back home in South Asian communities.
Yeah.
But here it is at the front, on the news, on the front paper.
Yeah, yeah. And we will touch upon some of those aspects in terms of stigma in the South Asian communities in a bit, but because you've identified it very clearly. When you look at South Asian countries, India, Pakistan, Bangladesh, Sri Lanka, Nepal, it's very much the case that stigma is very persistent. When you mention mental health, a family member or even somebody in the family, they just want to keep it quiet. So absolutely. And on that same line, in your experience, what are the main barriers to open conversations about mental health within our community?
A lot. Stigma is the first one.
Yeah,
Second one is the collectivism.
yeah,
Third one is the family honor. Fourth one is the spiritual. So I will touch based upon each of them.
Yeah.
Stigma is the first one. Stigma within the individual, the feeling of guilt. If someone opens about emotions, talks about emotions, it's very difficult to communicate in South Asian families, even to close family members about emotions.
yeah,
Because emotion is something of seen as a weakness.
yeah,
So it's difficult. And then the collectivism,
Yeah.
the nuclear families, where if one person is having a difficult time, the whole families take it on as a representation of themselves in the community.
yeah,
So they are basically stopping that individual to openly express their vulnerabilities or even openly seeking help in some cases. So that is another barrier. The third one is the spiritual connection, where everything with regards to mental health is somehow related to your religion, your spirituality, and then there is concept of some supernatural forces controlling you if you're talking about certain aspects of the psychiatric illnesses. So that is another one. So it's more of these areas, and then the basic missing emotional language items, even for expressing emotions. Our languages sometimes have barriers in terms of expressing those emotions and the collective vocabulary to express those emotions. So there's a lot of these barriers that an individual in South Asian community ex- uh, has to face before even expressing their emotions openly.
Yeah, it is multifaceted, absolutely, because it's not just the individual, it's their emotion, it's the guilt, like you said, it's that way of expressing it, the lack of appropriate words to be able to express themselves. And again, spirituality is very much a cornerstone of this as well. Even if they are presenting with symptoms, sometimes it can be downplayed as something else.
Absolutely.
So, absolutely, definitely. Now, recent studies show that South Asians in the UK are less likely to seek professional help for conditions like anxiety or depression. Why do you think this is the case?
I think I will touch upon one stat that basically startled me. That is, almost 1 in 5 South Asian is suffering from some sort of depressive symptoms. But then, and when you see that in the clinical load, you see very few people coming to you
Yeah.
as seeking for help
Yeah.
in the primary mental health care teams. The other is in terms of self harm.
Yeah.
South Asian women are more likely to harm themselves, and almost you will be startled by the fact that 25 to 33% of South Asian females from the age of 15 to 25 self harm in some form, but that never comes openly in clinical caseloads that you see. There are barriers in terms of expressing themselves, expressing openly their emotions, expressively trying to seek help from professionals. 30% of South Asian will go to a spiritual guru or a peer for their mental health problems rather than directly going to their general physician or a mental health care professional to seek help. And that opens them for more of exploitation emotionally, physically, financially than actually seeking professional help.
Would you say this is the case not just back home but also here? Are you finding that in your clinical load in both places?
I think absolutely. The thing is generational. There is an intergenerational gap. If you see the first generation migrants,
Yeah.
they tend to follow those times. And then the second generation migrants who are educated in this system are educated and informed more about emotions. So they are more well informed. They are likely to seek help. But the first generation migrants who come here, they are very hard in terms of not opening to their emotional liabilities or emotional vulnerabilities. And the reason for that is the first generation immigrant is more focused on the basic needs of food, shelter, clothing.
Yeah.
And there is a theory. So if the basic needs are not met,
Yeah.
then they won't talk about emotions. So the more focus of first generation immigrants is on those basic needs.
Yeah.
Once those are met, and that is the case in second generation immigrants,
Yeah.
and then the education that they are brought up in
Yeah.
is more of in terms of how to talk about emotions, how to seek help, when to seek help. And some of those are taught in the education system. They are more likely to seek help.
Yeah, yeah. And we've discussed about some of these things in terms of why and how, but what could also be done in your professional experience on how to overcome some of these challenges?
I think the first thing is education. Educate the masses in terms of South Asian masses how to identify emotions. Secondly, we need to overcome the cultural challenges in terms of opening out about emotions, talking about them openly without the fear of discrimination, without the fear of stigmatization, without the fear of being labeled.
Yeah.
So we need to take those fears down and those barriers down for people to open up, to talk about their emotions. If someone is sad, to talk with their family, with their friends that yes, I'm sad, I'm feeling low today. If someone is having other mental challenges, having anxiety in doing certain tasks, to open about yes, I'm feeling anxious now in doing that task. I'm not feeling comfortable. The problem is, especially in male South Asians, they are brought up and forged to have a hard exterior to face the challenges of the world. And they will never open up about their emotional vulnerabilities or the emotions, even simple emotions. It's hard for a South Asian husband to even open up about his emotions to their wife, let alone the world, to the professionals. So we need to foster a culture where it is okay to talk about emotions, where it is okay to tell someone that I'm struggling today,
Yeah.
where it's okay to seek help. And we as a mental health professionals, as a system, especially in UK, are standing there to help you.
Absolutely. And it's also kind of brought me back to the stat you mentioned about self-harming among South Asian females as well, and the high numbers that you're aware of, but they don't present clinically as well. Can you possibly touch upon why they might be self-harming, if that's okay to discuss it?
Okay, so the first thing is basically when, especially in South Asian females, when they are struggling with their mental health, they're having depressive symptoms, they are channeled into physical sign or symptoms.
Okay.
They will present as somatic symptoms of headache, tummy ache, feeling low, lack of energy, rather than identifying the emotion which is feeling low.
Yeah.
So first thing would be to foster a culture within the family systems to talk about your emotions. If you're feeling low, if you're feeling depressed, if you can't sleep properly, if you can't eat properly, if you have lack of energy, then you can openly express yourself to your family members or close friends.
Yeah.
The first thing is opening about those emotions.
Yeah.
And then struggling with daily routine lives. If you can open up with your family and friends, then you can seek help. And if there is difficulty in opening up to family or friends and you feel they're not understanding you,
Yeah.
you could directly go to online, type where the resources are, type where the help is available,
Yeah.
contact,
Yeah.
open up, talk. There are people there to help you.
Yeah.
So first thing is first, identify the basic emotions. And then if they're struggling with those, then to rectify that.
Okay. Yeah.
And once that is done, if someone is struggling badly and then they are going towards self-harm,
Yeah.
then that could be identified at early stages. They could be helped via various resources. They could be helped via talking therapies. They could be helped via medication. They could be helped via social engagement. So there are ways that we can help you. But the initiative, you need to take it so that we can identify symptoms early, rectify them and treat them, rather than going down the line and presenting in the crisis phase.
Absolutely. And it's also true that the onus is certainly to the individual to a certain degree to identify these symptoms. But with what you have now shared with our audience, they've also kind of become like family members, parents, siblings, elders. They've now also kind of become aware to kind of look out for some of these things that you've identified too.
Absolutely.
Which could be a good way for them to maybe, engage with that individual and open those lines of communication to make it a bit more easier so we can break down that barrier and stigma around it to,
I think the family support structure in South Asian communities is of key essence.
Yeah.
It could be our biggest defense in terms of identifying mental health symptoms early, and then try to identify those and highlight those to the relative professionals. If someone in your family is struggling with low mood, is persistently crying, is unable to do activities of daily living like basic acts of cooking, cleaning, and shopping,
Yeah.
they are depressed, lying in the bed the whole day, crying, you can identify those symptoms. Don't put them down by telling them that you need to carry on with life. You need to be hard. Sometimes it's okay to be soft. Sometimes it's okay to express emotions. Sometimes it's okay to tell your vulnerabilities to your close ones and to the mental health professionals or the professionals so that you can get help. So that at times you just need rest, respite, and someone to talk to. Someone who could listen to you non-judgmentally. Someone who could identify your emotions and then guide you to the right routes and the right treatments possible. So the collectivism and the family structure, which could be negative in terms of being enmeshed emotions, but could be a positive if those family members could signpost individual that, listen, we feel you're struggling right now, and we feel it would be better for you to speak to a mental health professional, to speak to your general physician, go online, research, find talking therapy. find someone who could help you during that phase.
Definitely. And how do cultural beliefs and family dynamics impact mental health, both positively and negatively, in South Asian patients?
So I think I've already touched upon it little by little, but I
Yeah.
will tell you the positive is in terms of collective identity, you have got the support structures there to help you. You won't be struggling alone.
Yeah.
There is some sort of collective family structure that could identify and help you during those challenging times.
Yeah.
If you are in a perinatal phase and struggling with the care of your baby, there would be family members stepping in to help you. If you are struggling doing some tasks of activities of daily living in terms of shopping, cleaning, cooking, some family member might step in and do that for you for a limited period of time. That is a helping supportive structure.
Yeah.
On the flip side, there is enmeshment.
Yeah.
Enmeshment of families and an enmeshment of emotions, where you might not be able to express yourself individually. And you might be labeled far too quickly as being lazy, slow, and some bad name instead of actually identifying that you're struggling with your emotions.
Yeah.
So that could be the negative. And then there is those remedies from back home that they bring in.
Yeah.
Ask to talk to a spiritual guru,
Yeah.
do some enigmatic act that will wave away those emotions.
Yeah.
Science has research now. We have moved forward from a century or two.
Yeah.
We have actually got therapies available that are researched and are helping people out there. We have actually got medications that can help you during that struggling phase.
Yeah.
And we have actually got supportive structures in terms of social work that could step in and help you during that struggling time. So please reach out.
Yep, absolutely. And it's also key, it's the medicines are not always bad. Having social work involvement is not always bad. They're there to support you, to help you through this. And it's because, you have been identified as needing help and support.
Absolutely.
So they are there, they're all there to help you through this process. So definitely. And do you think generational gaps between parents and children in South Asian families contribute to emotional stress or conflict?
Yes, they do. As I said earlier, the first generations that migrated here were more focused on the basic needs.
Yeah.
Food, shelter, clothing. That was their primary target to achieve. A lot of them might be still struggling in terms of in those basic things. Then they move up the hierarchy in terms of talking about emotions and things. So mental health is a topic at the back of their head rather than the forefront.
Yeah.
With the younger generation who are brought up in this system, who are taught in schools about emotions, who are taught in universities about emotions, who have friends who have been seeking help for long times,
Yeah.
they are more educated.
Yeah.
And I must talk about the devil as well in terms of the social media, which is bad in a lot of things, but sometimes it is a good in terms of spreading awareness about those symptoms. So yes, the younger generations are far more equipped
Yeah.
in terms of identifying those struggling emotions. And then there's that communication gap between the generations. The second generation is talking to the first generation migrants and finding it hard that they don't understand about emotions.
Yeah.
Part of the reason is because their life has been such way.
Yeah.
They've come from a different culture, struggled, trying to make an impact in this life and trying to grow and fulfill those basic needs. They haven't moved far from there to talk about emotions.
Yeah. There's no time for it.
Exactly. But sometimes you need to. You need to identify a struggling individual in your family who might need help, who might just need a good word from you, who might need just a signposting. That is of importance. We need to educate people about emotions and to talk about them freely and openly to avoid disasters, basically.
Yeah, absolutely. And what mental health challenges are emerging among South Asians youth in the UK today, like particularly among students and young professionals, because we've touched upon the like first generations and second generations. But if you think about like the present youth to a certain degree, what are you seeing in your
I
clinical
think the
settings
most
at all?
common is depression, followed by anxiety disorders. Then we have got PTSDs linked to various sort of abuses. Primary in South Asians, I see domestic abuse a lot, and I'm sorry to say that.
Yeah.
Then you see psychosis. Nowadays, I've seen ADHD a lot.
Yeah.
So these are the common presentations that I find a lot in South Asians. And one thing I want to stress upon very much is the perinatal mental health,
Yeah.
which is never talked about, and which is one of the most struggling time period for everyone, including our communities.
Yeah. Postnatal depression is very real.
Exactly.
And maybe when they were home, they probably had more of a social network and a family support network.
Absolutely.
Which might be missing here sometimes. Maybe the parents aren't here to support them. Their friends are equally busy, and the person can be struggling. And it's an expectation that as a mother, you just maybe get on,
Absolutely.
or as a father, you can just get on. But it's very real.
It's very real. It's far too common than we imagine.
Yeah.
Postnatal period is one of the most critical time for women's mental health. Postnatal blues are very common. Then there's postnatal depression and postnatal psychosis.
Yeah.
And the good thing in South Asian, if there are families, they can help. But some who have come here and are alone, or they have just one partner,
Yeah.
they would be struggling with that time period, because their own mental health, they're worried about baby, they're worried about healthcare anxieties.
Yeah.
And as first mothers, that heightens your anxiety. Even small things happening to the baby, small thing happening to you.
Yeah.
So sometimes you're far too focused on the baby than to realize that something is happening to you as
Yeah.
well.
Yeah.
Crying alone is not the answer. Seeking help is.
Definitely, and it's that awareness as well that it does exist. It's very real. It's not just them being all over the place and
Absolutely,
just being,
absolutely. The biggest take-home message from this TV show or this program, I want the South Asian families to understand: don't rubbish emotions under the carpet. Talk about them. Talk about them openly. Talk to your better halves. Talk to your family members if they're near you. Talk to your friends. It's okay to talk about emotions.
Definitely. And you're an executive member of the British Pakistani Psychiatrists Association. Can you tell us a bit about, so that our audience are aware about the BPPA, if that's okay?
So British Pakistani Psychiatric Association is the largest organization of Pakistani psychiatrists here in UK, with thousands of members. The organization is basically focused in collecting mental health professionals, especially of Pakistani heritage in UK, and spreading awareness about mental health diseases. It does seminars. There is a summer gala, there is an annual gala, which collects mental health professionals from all, not only South Asians, from all over UK, presenting their clinical experiences, sharing knowledge, getting peer-to-peer supports, getting posters out. And then there are programs in between when there is health education and mass health education happening via online programs. There are outreach programs back home in Pakistan where members of British Pakistani Psychiatric Communications community go there, work on the grassroots level to help improve the education about mental health, and actually doing field work to improve the basic infrastructures there. They're tied with various NGOs working there. They're working with government organizations there. So it's a massive organization which is bringing mental health to the forefront in daily topics in Pakistan and in Pakistani community here in UK. They touched upon the spirituality and mental health. They bring about outreach programs with mosques, with gurdwaras, with others, so that South Asian community can be educated about mental health. And not only in Europe, not only in South Asia, they're also working in Middle East, in various countries, going there, doing these health education programs to affect people on a massive scale. So it's a huge organization and it's growing by the day.
That's actually very helpful to know. So, for our audiences who might be interested in pursuing this mental health, for instance, in the future, is certainly an avenue for them to explore to know more about the BPPA. So, you mentioned this happens annually. Whereabouts in the UK does this happen? Does the location change? Or?
So it changes. The last ones were in Leicester.
Okay.
I recently attended the Summer Gala in Leicester Marriott.
Okay.
There was one program in Saudi Arabia. There are programs planned in Karachi this year, and there's also another program then planned in Leicester.
Okay.
So it goes globally, and not only the physical events, the online events are throughout the year in terms of spreading awareness, collaborating with various NGOs in their programs and government organizations back home in Pakistan to improve mental health.
Excellent. And that brings us to the end of this episode. We aren't done yet. We have much more information to continue with Dr. Phulpoto. So to be continued. Until next time.